This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Alex Menze. I'm with the Permanente Medical Group in Sacramento, California, and the California Air National Guard. Today, I'm interviewing Brooke Conway Kleven from the School of Public Health at the University of Nevada, Las Vegas. We're going to discuss a paper published in Neurology titled Longitudinal Changes in Regional Brain Volumes and Cognition of Professional Fighters with Traumatic Encephalopathy Syndrome. Good morning, Brooke. Thank you for joining us today.
Hi, thank you.
Today, you have some exciting news to share about a biomarker for traumatic encephalopathy syndrome. Could you please tell us about what you and your research partners discovered?
To start off, traumatic encephalopathy syndrome, or just to refer to as TES, is the clinical presentation of CTE, which is what we've heard about more in the media with chronic brain injuries in professional athletes or military. And so TES was developed as a set of clinical criteria based on some studies of brain bank studies after they did postmortem analysis of CTE and found, based on either medical records, family, or any other reported records of different clinical criteria that people may have exhibited prior to death with CTE. So based on that, this group of criteria was established in 2014 and then was found to have pretty low specificity. So they went back to a consensus conference with the National Institute of Neurological Disorders and Stroke. They did that in 2021, and this updated criteria was established, and our study was one of the first longitudinal assessments actually utilizing this updated criteria in a cohort of professional athletes. And so what we specifically found was that in a group of professional athletes all exposed to substantial repetitive head injury, that people who were TES positive had significantly greater changes in brain volume in specific regions of the brain, and then also subsequent cognitive decline in reaction time.
Okay, so it sounds like you were able to correlate MRI findings of changes with these individuals' exposure to head injury and cognitive changes. And so we were able to combine all three. Am I getting that approximately correct?
Yes. And what was interesting is that even though all athletes were exposed to what we considered substantial brain or head injuries, some who were TES positive had a very different change in biomarker and or clinical presentation than those who were TES negative.
Well, that's pretty exciting. So why don't you tell us a little bit about your study subjects? Who was included in this study?
So our study was drawn from a larger cohort of about 800 active and retired professional fighters. This cohort is the Professional Athletes Brain Health Study. And so all athletes in this cohort were either boxers, MMA fighters, or just general martial arts athletes, meaning any of the various disciplines of martial arts. The athletes we specifically used for our study had to be at least 35 years old and had to have completed at least a minimum of 10 professional fights within their career. So they could be active or retired as long as they met that criteria. The minimum of 10 fights was because we wanted to use that as a cutoff for substantial exposure based on previous research. So from this criteria, we had 117 males and 13 females in the study, 40% of which met the criteria for TES, and 75 of those athletes were boxers, 41 were MMA fighters, 6 were martial arts, and then 8 competed in various of those disciplines. And then about half of the athletes were retired and approximately half were active.
Okay, so this is a very professional group of individuals. So I'm a general neurologist, so I practice in the civilian setting, but I'm also in the Air National Guard and treat the military. So my question for you is, does the data from this research at this time help assist our clinical neurologists in the diagnosis and treatment of TES. Is this something we can apply at this moment, or is this something where we still need some more information to help with our populations?
So unfortunately, the clinical criteria for TES are only intended just for research purposes at this time, just because they haven't been validated against postmortem diagnosis of CTE. So we truly can't say that this updated criteria is 100% accurate of a postmortem diagnosis. So because of that, it wouldn't be directly applicable to a neurologist saying, utilize this criteria to then diagnose your patient. But more so what's important of these findings is the education and the awareness that it can provide for neurologists. So when they are seeing patients with repetitive head injuries, they can have in the back of their mind these criteria and how they could potentially maybe help provide some preventative efforts or education to the patient rather than providing a direct diagnosis.
Okay, just to jog all of our memories on the criteria again, could you go over those 3 or 4 criteria real quick?
The main criteria is the person must have a history of substantial exposure to repetitive head injuries. So that is a very vague criteria because depending on the sport, it's different. So for previous research in fighters, it showed about 10 professional fights was a good cutoff point for substantial exposure, whereas football, 11 was substantial exposure, years of professional football playing. So that's where it gets a little messy per se, is what is considered substantial exposure. But with that being said, we do know that any exposure to repetitive head injury is going to increase the risk. That's the primary criteria. The next is that the person must have at least one core clinical feature. So that would be either cognitive impairment or neurobehavioral dysregulation. And then the person must also show a progressive course of those symptoms. So either progressive cognitive impairment or progressive change in neurobehavioral dysregulation. And then the third thing is that the symptoms must not be accounted for by any other disorder or diagnosis, meaning they can't have a history of depression, PTSD, Alzheimer's, Parkinson, or any other psychiatric diagnosis. Any of that would lead to that being a primary cause of the symptoms more so than it being TES related. So that's the updated criteria.
It's good to keep those things in mind. In my practice, I see a lot of potential overlap between these psychological things as they cross over into the head trauma world. So it can be tough to distinguish, but any information that might help to distinguish between the two for a clinical neurologist, whether it's coming out in the near future or a little bit later, is going to be helpful. So thank you for doing this research for sure. So Brooke, one of the findings is that the fighters with lower education were more likely to be positive for traumatic encephalopathy syndrome. Does that mean that getting more professional degrees can make a person immune to brain trauma?
I wish. Wouldn't that help so many of our problems? Unfortunately, no. Typically, education is used as a proxy in a lot of studies such as this. So when I say that, meaning education could be a proxy for socioeconomic status, just because that's a very difficult thing to measure in a longitudinal cohort of people. So knowing their educational attainment can give some sort of input as far as their socioeconomic status. But then there is question to any neuroprotective effects of education. So leading into what you did mention, is there possibly some level of neuroplasticity happening because of continued education or cognition per se? We don't know, but in this study specifically, we did use it more so as a proxy.
So that's a lesson to anybody out there going into cage fighting that's listening. If you want to do that, you have to get another degree. But no, just kidding. So it is interesting whenever we find these associations because there is so much to learn about the neuroplasticity of the brain. I've interviewed other individuals in the brain injury world, and they talk about the brain you take into the injury is the brain that you're dealing with afterwards, meaning if you have that resilience and that plasticity, you're going to do much better after a brain trauma. And I can't conclusively support that, but I do think that it is supportive in many ways. So, Brooke, where do we go from here with all this research? There's a lot of research out there on concussion and traumatic encephalopathy, but what do you think's coming next? What are you particularly excited about in this type of research right now?
I'm really excited to see a set of biomarkers finally be able to be utilized. One, obviously the study isn't looking at acute concussion, it's more the long-term degenerative changes, but this is obviously the first step in moving forward to knowing what our risk factors look like. And then once we can get an idea of what the risk factors look like, then we can go into more the diagnostic markers and how we can therefore use it in a clinical sense. So we're in obvious very early stages in just understanding the very basics of this, but ideally in the long run, similar to how we have a set of diagnostic criteria for an MI when a person goes into the ER, it would be amazing to have another set of biomarkers that we could do the same thing when somebody comes in with a concussion rather than just having a CT. And obviously a CT, unless you're having bleed, is pretty inconclusive. So long term, it would be great to have that. Again, like I said, this study specifically is looking at more of the chronic changes, but the great thing with this is we want people to continue to be active with sports. We want people to be able to do the things they want to do without fear of developing CTE in the long run. So if we can have a set of biomarkers that can predict how people are going to progress and why certain people with exposure to brain injuries or repetitive head injuries are having this versus other people who are still having this exposure as well are not, that gives both clinicians and patients a more informed decision.
Yeah, I completely agree with you. I think that this is great work being done, and I'm so appreciative of your time today, Brooke, and for sharing your expertise with us. This is Alex Menze, and I've been speaking with Brooke Conway Kleven about her paper titled Longitudinal Changes in Regional Brain Volumes and Cognition of Professional Fighters with Traumatic Encephalopathy Syndrome. Thanks again, Brooke.
Thank you.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.